School officials in Tupper Lake, New York are in the midst of replacing water lines in their school buildings after a recent state report raised concerns about the levels of lead in the district. The report says state officials tested more than 100 water outlets in the district over the past 5 years, and that 22 of those came back with readings that exceeded the lead action levels. Tupper Lake isn't the only district that came back with higher lead levels. That's because the allowable amounts in New York State have changed from 15 parts per billion to just 5 parts per billion.
So what school districts across New York State are finding is that more of their outlets are testing for high levels of lead because the standard was increased so much.
School officials say they plan to have the new lines installed and the water retested by the beginning of the school year. The report was put out by the state comptroller's office. Comptroller Tom Dinapoli recently joined us in our studio to talk about that and a new report critical of the quality and availability of health care in many rural counties across New York State, including here in the Adirondacks. And New York State Comptroller Tom Dinapoli is our guest this week. It's nice to have you. Appreciate you taking the time to drive up here to the North Country.
It's been a while since I've been here, so I'm very happy to be back.
Well, you know, the last time we caught up with you, you were here in Plattsburgh touring the downtown along Market Street before it got a major facelift. And the proposed DRI project that is still undeveloped, you met up with then Mayor Chris Rosenquist. That was 3 years ago. For the most part, the city of Plattsburgh doing okay financially now, 3 years later?
Yeah, they haven't shown up on our fiscal stress monitoring system as being in a level of stress. That's kind of our early warning system to see if a municipality or a school district is headed to a budget or fiscal problem. So, so far so good. But I think, you know, just as for the state, it's a time to be cautious. A lot going on in terms of where's the economy headed, what will that mean for sales tax revenue, right? Important to our cities and our counties. What will be the impact of the federal government on the state budget? And so much of the state budget is funding that gets sent back to municipalities and school districts. So I always say there's a need for local officials at the city level, at the town level, to be cautious. There's a fair amount of uncertainty as to where the revenue picture is going to be headed in the next couple of years.
And you mentioned the sales tax revenues up in the first quarter, in the first half of 2025.
Yeah.
3.7 statewide, but Clinton, Essex counties, more than 4%. Franklin County, 8% increase.
You know, for the broad range of the North Country counties, I think other than St. Lawrence, they were all up, you know, which was a good sign. I know there's been a lot of concern, especially, you know, the impact of what's going on with the relationship with Canada. Would there still be Canadian tourism, Canadian visitors and spending? You know, so it was interesting looking at those numbers. It's not showing up in terms of a hit on sales tax so far. But I think it's fair to say, at least anecdotally, whenever I travel, either in this part of the state or in Western New York, anecdotally people are seeing less in terms of bookings from Canadian visitors. I think that's true down in New York City as well. So I guess it's a positive sign that the sales tax numbers were still up, you know, for this part of the state. But again, we need to track it. We look at it carefully because for our local governments, big revenue source. For state government, after personal income tax, sales tax is the second biggest revenue source. And it certainly is an indication of where the economy may be headed, consumer confidence, you know, so on. So there's a reason we look at, but for now, this part of the state, good news on sales tax revenue.
And in the same breath, though, when you put out that release, you did warn that the second half of 2025 could be a different story. And you mentioned the federal budget cuts, potentially inflation, other economic factors could.
You know, I think the big uncertainty is the impact of tariffs in the long run. You know, what really will that mean, and will that result in increased prices and keep inflation going? So, a fair amount of uncertainty at this point.
You're also warning about what you see as potentially a pretty sizable budget deficit coming up in the next few years, especially with the cuts from the federal level.
You know, the out-year budget gaps are over like the $34 billion range, and that's without factoring in the federal cuts. You know, part of the challenge we have, the reconciliation, the budget bill, whatever you want to call it, we're still analyzing what it's going to mean, and some of those cuts are not happening all at once, they're being phased in. shock of shocks, some of them won't happen until after the midterm elections. I'm sure it's just as a pure coincidence. But there's no doubt on the healthcare front particularly we're going to see a hit. And certainly for this part of the state, you do have a significant percentage of people that are on Medicaid. So the extent that cutbacks on Medicaid, on the essential plan, that is going to hit individuals, families, local governments as well, state, all of those are funding partners. And some of that you're going to see phased in over time. And the concern that I have is that folks that may now lose their health care coverage, they're still going to need health care at some point. So they're going to show up at our hospitals, emergency rooms as their doctor's office. You've got rural hospitals in this part of the state, 3 of the 6 of our state that have the highest percentage of patients that are on Medicaid are in the North Country. And they're already on the edge in terms of their finances. What's going to happen to those rural hospitals? And as you know, part of the federal bill has the special pot of money for rural hospital transformation to try to offset some of the cuts. But there's no indication about how that money is going to be distributed and whether or not New York's hospitals and our North Country hospitals are going to be able to benefit from that fund. So we're going to have to look carefully at that. But certainly in terms of the state budget, in the short run, $750 million hit in this year's budget just on the healthcare piece, at least $3 billion going into next year. Given the size of the state budget and the fact that at least so far for the first quarter, our revenues are up higher than projected, in the short run, I think we could absorb that. But again, it's why we have to be very careful, look at spending and revenue, and really try to prepare for what's coming. One of the suggestions I made, some took it as a criticism of the budget process earlier this year in Albany, is that there really was no contingency being put in for what we knew would be some level of federal reduction in support. So, we do have reserves that have been higher than they have been for many years, but even the reserves are down somewhat. Some of that money was used for paying off the federal unemployment trust loan that we owe, which was a good policy decision, but it did deplete some of the reserves. So I think next year's budget cycle at the state level in Albany is going to be more challenging. Going to have to be some tough choices on spending, on revenue. So I think the legislature and the governor are going to have a lot to contend with next year. I'm hoping that the pressure that we're all going to be under will result in a bit more strategic thinking, maybe be a bit more creative about efficiencies. Again, we don't want to hurt people, and I think that's the concern I have about the federal approach. Between increased costs administratively and actual cuts, people are going to get hurt. One of the statistics I like to point out, you go back a decade or more ago, we had about 10% of our population in New York without health care coverage. And because New York has done Medicaid expansion and the essential plan, some of the Obamacare, so, we went down to less than 5% without health care coverage. We're one of the states that have made the most progress in that regard. What's happening coming out of Washington is going to go in reverse. We're going to have more people without health care coverage. That's a concern. We'll have to figure out how to manage it. I don't think, and this is something certainly our state leaders have said as well, the state's not going to be able to backstop all of these cuts. So, as I said, more difficult choices, and maybe at some point we'll see some reversal in terms of what Washington's thinking about.
You also recently have looked at the access to health care in 16 of the most rural counties across New York State, including Essex, Franklin, and Washington, and Hamilton up our way here in the North Country. Your report on that, just out within the past couple of weeks, found a pretty severe shortage of healthcare professionals in those rural communities. Does that significantly impact the availability and quality of healthcare?
It's definitely, it's a challenge that's out there. Anybody that lives in the rural areas in this part of the state know that. So you look at the numbers in terms of primary care physicians, OGBYN, pediatric, dental services, dentists. Hamilton County has no dentist. Mental health professionals, very severe issue there. It's something we need to do a better job of addressing, especially when you look at, as our earlier report pointed out, declining population in many of these counties, but an aging population needing greater services. One of the big impediments, again, no surprise, many people not living near a population center, limited public transportation options. We need to do more as far as telemedicine. it gets to the broadband question, making sure we have appropriate access, and perhaps more opportunities to bring healthcare services to where people are. So mobile services, expanding on school-based health clinics. I mean, so there are some strategies there, and doing more to provide incentives and support for people to go into the medical professions and to be located in rural communities. So I think there's more steps we could take. Some of this is already underway, but we did this report really to shine a brighter spotlight and to say, folks, this is still a big issue. And again, because of what we're seeing coming out of Washington, perhaps even more dramatic need for us to deal with these issues that have been out there for a long time.
You routinely do audits of municipalities and school districts across New York State. One you've just released in the past couple of weeks is critical of the Tupper Lake School District and testing that schools are required to do under New York State law to check for lead. There were some elevated levels in some of the samples, but the audit is mostly critical of the way they did the testing and not following all the procedures that they needed to. Are they working with your office and other state officials to try to correct that?
Yeah, you know, I'm glad you raised it because we've been doing audits across the state of school districts, you know, because obviously our children would be particularly vulnerable in terms of the lead issue. And what I found interesting, and I give credit to our audit team for identifying this as an area that we need to take a look at, these audits are getting tremendous attention locally. So you mentioned Tupper Lake. I don't know if it's of any comfort, but Tupper Lake is not alone. And what we're generally finding is that the school officials appreciate maybe too strong a word, but they understand that this is an issue, and the fact that we are highlighting it gives them the opportunity to take the steps to remediate and do what they have to do. So it needs to be a collaborative effort, obviously, with the local public health officials and the school officials as well. So I'm confident this is an example of an audit area, maybe not what folks would traditionally think we'd be looking at, because it's not necessarily pure dollars and cents, but it's quality of life, certainly within our purview. So we're really hoping this is going to give the opportunity for places like Tupper Lake to just get ahead of this problem and make sure it doesn't have any harmful effect on our kids.
In recent months, you've also put out reports on child poverty and how in some cities in New York the rate is particularly alarming, well above the average. You've talked about childcare and the need for childcare, and again, especially in rural communities where there are childcare deserts, and trying to help parents there. The governor did have an increase in the child tax credit in the budget this year, but is that something that for rural counties and parents is still a real problem?
Oh, I think so. And I give the governor legislature credit for, as part of the broad agenda on affordability and trying to address that, with the middle class tax cut and the rebate that some folks are going to get in the fall, they identified child care and expanding the child care tax credit as an important part of the affordability agenda. But it's not going to completely solve the issue. And again, you point out the child care deserts, similar to the issues we were talking about with health care, again, not being located near population centers, transportation issues. And you need to look at child care as a very important part of the employment picture. If people don't have access to quality child care that they can afford, not going to be in the job market. And obviously that's going to affect women particularly. And so it just exacerbates some of the challenges that are out there. So that's important to the business community as well.